Good afternoon, I'm Dr. Ruth Lucas, and today I'm going to talk about breastfeeding, but I'm going to talk about breastfeeding a little bit differently. I want to talk about breastfeeding as it takes two. It takes mom's effort and baby's effort. When we think about breastfeeding, we think about this beautiful picture of mom and baby together, bonding and attachment, as mom does this sacred interaction of providing life-giving nutrition of breast milk during breastfeeding. And we know that not only does mom give this amazing nutrition, but as mom and baby interact during breastfeeding, it establishes this relationship between them across the lifespan, and it helps establish health across the lifespan. And so we think this is very, very important. And as a society, we in the last 20 years have made it very, very important for mothers to breastfeed their infants. In fact, right now, over 80% of mothers initiate breastfeeding with their babies. And it's beautiful and it's wonderful. However, by 2 weeks after delivery, moms start experiencing problems. Sometimes those are problems that are easily fixed, but then sometimes moms aren't prepared and they aren't sure what to do next. And so many women, beginning at 2 to 3 weeks, start giving the baby more and more milk through a bottle. And we know by statistics that 1.9 million women did not meet their breastfeeding goal, even though over 3.2 million babies were at least given the breast at least once. So some problems for breastfeeding occur from the mom, but some also occur from the baby. We know that there are certain characteristics of mothers that make them very successful. If they have good resources, if they are well educated, if they've breastfed before, if they have time off of work. But we also know that the infant is part of this mother-baby interaction that is breastfeeding. But when we look to describe the characteristics of what makes babies successful at breastfeeding, the descriptives become much thinner. The two metrics for breastfeeding success for infants is that they gain enough weight and then that they're not hungry after breastfeeding. There's really no description of who they're like. So I want to give you an example to kind of give you an idea of what I'm talking about. I'm going to talk to you about the story of 3 infants. The first infant, born to this mother of all 3 infants, was born, and they were very excited that he arrived. But although mom worked in healthcare and had some experience helping other women how to breastfeed, this child had a very difficult time getting a good latch and sustaining it. In fact, this infant was having such a difficult time that by 3 days, mom had bruising, bleeding, blistering, and the baby was very, very hungry. So mom reached out to some of her colleagues to help her out with this. And one colleague had some suggestions, and when she discussed those suggestions with another colleague, she was told emphatically that if she did those things, that this baby would be failure to thrive and never grow properly. So you can imagine how frantic this mother was during that first week when breastfeeding wasn't going well, and she didn't know how to unpack and help her son latch and sustain his feeding across time. Her first professional was able to come in and give her some direction and give her some support, and within a week, he had successfully transitioned to breastfeeding full-time. And he continued to breastfeed up until 7 months. Now, the second baby was delivered, and he knew what to do right away. In fact, he was so good at it, he probably could have taught the entire floor how to do it. And he continued to breastfeed until he was 1 year of age. The third infant given to this mother came out, latched, but then he just didn't really pay attention. Mom had to work to get him to focus to breastfeed. In fact, this continued so much throughout the first year of life that he just wouldn't focus on eating. He was too interested in doing other things. So he didn't transition to table food until well after a year. So mom continued to breastfeed this infant until he was 2 years of age. The take home from this story is breastfeeding success does not totally depend on mother's effort. Each infant presents with different behaviors during breastfeeding. Their effort to latch and suck during breastfeeding has been called by some as personalities, and each infant's effort may lead to success, but may also be part of the common reasons why mothers and infants stop breastfeeding. In fact, it's very clear that there are 3 common reasons: ongoing maternal trauma, like we heard about in the story, perception of milk insufficiency, and lack of infant satiation. Well, we argue that the perception of milk insufficiency and ongoing maternal trauma comes from an ineffective latch. If infants aren't able to latch correctly, they will not receive enough milk during the feeding, and they will still seem hungry. And mothers may see this as they're not producing enough milk. Lack of infant satiation could actually be because of ineffective patterns over time, which I call support. Sustaining an intraoral pressure pattern, which is regulated over time. And if infants aren't able to sustain that latch and sustain that pressure over time, they're not going to stimulate the mom's brain and breast conversation, which is pivotal to creating enough milk supply for baby to have enough milk for growth. So baby's contribution to this is to stimulate mom's milk supply. So there's the maternal side, which some mothers do have issues with milk supply because of neurohormonal imbalances. But it might also be not just mom, it could also be baby's effort. So it's not that we shouldn't try to brainstorm and identify what might be barriers on the maternal side to produce enough milk. But the investigation needs to not stop there. We need to ask very important questions about what is happening on the baby side. Are they able to create that latch? Are they able to sustain that latch over time so they're getting enough milk? We know that within the first couple of weeks, if the baby has not successfully created that suck, which is supposed to be natural, right? Babies know how to suck when they're inside. So why is it so hard? It's because babies have to learn how not just to suck on their fingers, but also how to make their mouth bigger and be able to create that latch and sustain it. In and a while, they're figuring out this world when there's so many things around them. So they have to figure out how to eat, and they have to figure out how to tune out the world around them so that they are successful at breastfeeding, which we call regulation. There are some people who have thought about this. A very popular description of baby feedings was created back in the 50s, and they created 5 different types of personalities. They created the barracudas, the excited and effectives, the procrastinators, the gourmets, and the resters. And the barracudas had a very vigorous latch and a very vigorous suction across time. The ineffectives had a difficult time starting to feed. They would bob on and off the breast, and then get upset, and if they could settle down, they would feed okay, but if they didn't settle down, they didn't feed very well at all. The procrastinators never figured out how to latch and how to sustain. Maybe this sounds familiar to something that happened with you. The gourmets seemed to take their time to savor everything and not wanting to be rushed. They wanted to take their time getting latched. They want to take their time feeding, and they don't want anyone to bother them. And lastly are the resters. They're very consistent about what they do, but they're not very fast. And these feedings can take 15 minutes, 30 minutes. The babies grow properly, but they just take their time. The one thing that's not been decided back when these personalities were described is what we know to be normal breast physiology, which is the combination of a vigorous latch and then a consistent pattern over time. So I would call a combination of barracuda and rester. So as we talk about breastfeeding success, we need to stop talking about not only mother's effort, but as mother and infant's efforts, and mother's job to support their infant's effort. Sometimes infants cannot breastfeed, and mother's best support for their infant, for that attachment, for that bonding, for that relationship across time, is to support them by giving them nutrition through a bottle. And the best nutrition would be express breast milk. Breastfeeding is a survival mechanism. What does it mean if infants aren't able to breastfeed even with mother's help? We know that this increases their risk for breastfeeding cessation, but we need to think about telling moms and the people important to them that they may need help learning as they grow and develop. And that the inability to breastfeed may be the sign of disorganization in their ability to put together information and their ability to figure out their world. And they may need some help as they grow. Healthy mother and infant interactions ensures best success for the child across the lifespan. Breastfeeding is the best nutrition for infants. And if infants are not able to breastfeed, then mothers needs everyone's support to care and feed for their baby for the best outcome of this beautiful new baby and the lifespan they have ahead of them.